Hello and welcome. In this session, we'll explore L4, understanding how public and health promotion contribute to health and social care services. Discover how health promotion shapes public health and improves outcomes through effective policies and strategies. Health promotion transcends traditional healthcare. It integrates health into policymaking across sectors. This approach includes legislation, fiscal measures, and organizational changes. It aims for equitable health, income, and social policies. By identifying and removing obstacles, it makes healthier choices easier for policymakers. Health promotion supports governments and communities in tackling health challenges. It builds healthy public policies and supportive environments. Strengthening community action and personal skills is key. This comprehensive approach enhances public health services. It fosters resilience against health challenges. Health promotion is an established concept. Its roots trace back to recognizing external factors affecting health. Historical reports highlighted the role of conditions like poverty and disease. The term health promotion was coined in 1945. It emphasized coordinated efforts for a healthier society. Health education imparts knowledge for voluntary healthy behaviors. It involves learning experiences to improve health understanding. Health promotion, however, takes a broader approach. It involves multiple sectors and addresses diverse health influences. This comprehensive method adapts to various health determinants. Socio-political factors influence public health promotion. National issues like healthcare funding and political priorities play roles. Cultural norms can impact health behaviors and perceptions. Education levels affect public understanding of health messages. Media shapes public opinion on health issues. Global health diplomacy affects international collaboration. Economic disparities impact countries' public health investments. Globalization influences health-related goods availability. Migration introduces new public health challenges. International organizations shape public health policies globally. Health promotion influences healthcare service demand. It educates the public about preventive measures. Disease prevention campaigns reduce treatment needs. Promoting healthy lifestyles decreases chronic disease incidence. Early detection campaigns lead to cost-effective treatments. Health promotion enhances health literacy. Informed individuals manage their health better. This reduces unnecessary healthcare visits. Mental health awareness increases service demand. Addressing social determinants improves overall population health. Health promotion can shift public perceptions. Effective campaigns influence health behaviors. Reduced tobacco consumption lowers related treatment demand. Campaigns can either increase or decrease specific service demands. Public perception changes are crucial in health promotion. International campaigns shape healthcare demand. WHO campaigns raise disease awareness. Vaccination drives increase short-term vaccine demand. Global health crises spike healthcare service demand. Health behavior campaigns aim for global behavior change. National policies affect healthcare demand. Universal healthcare increases service access. Health promotion policies initially boost preventive service demand. Health insurance mandates reduce financial barriers. Resource allocation policies influence demand in specific areas. Addressing these factors requires a holistic approach. If you have any questions, please don't hesitate to reach out on WhatsApp at 074-843-61688. We look forward to seeing you again at the next session. Thank you.